friends on the Planning Policy Commission. This is a special meeting, the Human Services Commission. The purpose is a joint meeting between us, the Human Services Commission, and the Planning Policy Commission. The purpose specifically is to discuss the Healthy Community Strategy Project. What I'd like to do, please, is just go around, do a quick intro, maybe name your commission, and one sentence, no longer factoid, about your connection to Issaquah and or your commission. It could be anything. And then I'll turn it over to staff and we can get on with the meeting. For those here for public comment, if you notice in the agenda, that's scheduled for towards the end of the meeting, and we very much would welcome that if that's something you choose to give, and we will be sure to save time for that. So again, my name's Derek Franklin. Factoid is I've got a couple kids in the district and spent a lot of my time parenting, and I've been on the commission for 3 or 2 to 4 years. I'm not quite sure. Susan, would you mind kicking this off, and we'll go around the room this way?
Sure. I'm Susan Leonelli. I'm the Human Services Commission. I've been on the commission for about a year and a half, and I've lived in Issaquah Highlands for 13 years, and for the very first time, I just started riding the bus every day to a job in downtown Seattle, so that's been interesting for me.
Hi, I'm David Fujimoto. I'm the Director of the Office of Sustainability here at the city, and also staff person along with Monica to the Human Services Commission. So happy to have you all here with us tonight.
Hi, I'm Brooke Fraser. I'm a junior at Issaquah High School. I am a member of the Issaquah Youth Advisory Board. Sorry, I forgot the name for a second. And so yeah, I'm the youth representative.
Hi, my name is Jolie Quanhart. I'm on the Human Services Commission. This is my first year, so I believe maybe 5 months or so. I've lived in Issaquah with my husband and 8-year-old daughter for 5 years now.
Hello, my name is Monica Negrilla, and I'm the Human Services Coordinator with the city here, and I'm also staff for the Human Services Commission. And I've been here with the city for almost a year.
I'm Sonia Sahai, also the Human Services Commission. Similar to Jolie, been a commissioner only for about 6 months. Lived in Issaquah for 13 years.
I'm Rebecca Smith, and I'm with the Issaquah Human Services Commission, and I've lived in Issaquah for about 12 years.
So I'm Joan Probel. I'm the chair of the Planning Policy Commission. I've been on the commission for, 12 years. So listen to all of you newbies. It's really nice to be part of the commission. So I've just been part of the city for a long time in different organizations in different ways. So.
Bill Reinhardt, also on the Planning Policy Commission for about a year and a half. My wife and 2 boys have been in Issaquah for about 10 years now.
Trish Hainonen, I'm the staff for Planning Policy Commission. Been doing it for many years, and I've loved them all. So it's great to have these groups together tonight on such a juicy topic.
I'm Loretta Jenkins. I'm on the Human Services Commission in Issaquah, and I've been around Issaquah for 30 years. So I've got a long history.
I'm Randy Harrison. I've been on the Planning Policy Commission for about 6 or 7 months. Before that, I was on the Development Commission for about 18 years, and I've been in Issaquah since 1988.
Janice Carl, I've been on the Planning Policy Commission for about a half a year. I've been in Issaquah for almost 10 years. Close to being an empty nester. Just got a little bit more to get my high schooler out the door. And what was I going to say? Retired from Regents Blue Cross Blue Shield, and my husband is disabled, so I have an interest in that kind of perspective.
My name is Jason Boyce. I'm with the Planning Policy Commission. I've been with it for a little less than a year and a half, and I believe I've been in Issaquah for 13 years. And before that, I used to come out to the woods with my friends and hang out in Issaquah. I'm very familiar with Issaquah.
My name is Aina Haina. I've been in Issaquah for almost 18 years, in the commission for maybe 4, I think. And I have 2 kids in Bellevue College, a husband, and sons.
Well, thank you, everybody, and agenda is pretty clear tonight. Moving on to agenda item 2, which is the bulk of the meeting, I'll just turn it over to staff, David Fujimoto, to welcome our guests and move on with the agenda.
Very good. Thank you, Derek. As I said before, thank you all for joining us here tonight. It's really helpful for us to have a joint meeting of the commissions to talk about the healthy community strategy. And we're at a kind of a checkpoint in the project. Some of you will hear a little bit more background about this project, but this started as a city council goal to take a look at the health and well-being in our community and identify ways that we can help to improve health and health equity in the community. And some of the past work has been looking at some of the data side of that, and this year we also recognized that there was some related work in the housing strategy. The housing strategy talks about affordable housing and services that complement housing stock in our community and ways to bolster that. And the other piece is that the city's also been taking an increasing look at our senior services, both with our senior center as well as other needs for seniors in the community. Some of those are housing related, some are service related. So we've taken those bodies of work and integrated them all under this umbrella of the healthy community strategy. So it has many different kind of populations and programs and elements that are connected here. So it's a really it's an opportunity to take a holistic look for a variety of populations. So your perspectives are really helpful, given all the different background and different things that these two commissions have been looking at over the years. So we've been working with Burke Consulting, who has been helping us with some of the data side of the equation and is helping us to kind of move into the strategy. And so I wanted to introduce Erica Rett, who's the project manager from Burke, who's been helping us on that side of the equation. She's going to spend a little bit of time giving us some background, getting us up to speed, and then we'll also have time later on tonight. We'll break up into some groups and we'll get some feedback from you specifically. So with that, we'll turn it over to Erica.
Just for some of you that aren't used to being filmed, because we knew this was going to be such an important melding of the minds, we're actually, I'm hoping, being taped right now so that those of us that aren't here, not those of us that aren't here, those that aren't here tonight will be able to watch all the fascinating discussions that we had. And I'd also warn you, the whole room is a microphone. So I know sometimes you only watch what you say when you actually have a microphone right in front of you, but the whole room is a microphone. So I just wanted to warn you about that. Because sometimes it's really funny what gets picked up. So I just wanted to warn all of you, because I know some of you aren't used to being on camera and with a microphone. So that's enough.
Thank you for that reminder.
I just I wanted full disclosure.
Hi, I'm Erica Rett from Burke Consulting, and we're going to talk today about the healthy community strategy. So for this part of the meeting, I'm going to give a presentation that gives you some background information. Then we're going to have a discussion. Then we'll just quickly go over the next steps. So a community needs assessment is about building a healthy community. And in 2016, the city began the journey towards building a healthy and more equitable community for its residents. And what it wanted to do was try and define what a healthy community is and what kind of a place, what kind of a city you would have where all of the systems work together to ensure that residents have a really great life. And so it goes beyond the individual decisions that we associate with health, such as eating right or exercise or getting enough rest. It actually goes into what we call social determinants of health. And these are the social, the environmental, and the community factors that influence whether people live their best lives. And if you can see, here are some of the things that influence health in a community. So there's things like complete neighborhoods, whether or not healthy food is available, if there's affordable and quality housing, fair justice system, public transit, universal design. There's many, many factors that go into whether or not people live their healthiest and best lives. So the city conducted a community needs assessment, and during this assessment, they talked with lots of different people in the community and found that there were 4 areas in Issaquah that were keeping the community from being as healthy as it could be. So the purpose of the healthy community strategy is to take up the cause where that work left off and to identify strategies that the city can pursue to make a positive difference in health and equity. And it basically has this underlying commitment and this belief that all the members of the community are important to the success of the community, and that meeting the needs of the community is a shared responsibility between the members of the community. So to begin working on this strategy, we verified the top four issues in the community needs assessment, and we did this by talking with stakeholders, which included some nonprofits, community organizations, and the like that are serving Issaquah residents. We also did a variety of engagements with members of the community, particularly some that we thought the other information that we had gathered particularly pointed to that those were people in the community we should talk to, or people that hadn't been talked to previously. So in the community needs assessment, one of the top items that was mentioned as a need was stable housing. So people across Issaquah's income spectrum have a hard time finding housing that they can afford. It's particularly difficult for people who have low or fixed incomes, but it's a challenge for people of a variety of incomes. And it's also a challenge for people who have special needs due to age or disability. And what we find is that the lack of stability in housing has all kinds of health consequences because people start to make trade-offs. When you're spending more money than you can afford on your housing, then you don't have as much money to invest in health care, child care. You don't have as much money to support transportation and other needs of life. So this type of thing goes across many incomes. The other thing we found is that there's a number of behavioral health issues. These types of behavioral health issues affect both youth and adults in the community. And with these issues, what we see is some higher levels of anxiety, depression, and stress for Issaquah, higher incidences of substance abuse. And also we found from talking with people that there's a number of cultural stigmas around seeking help. Both cultural stigmas that are part of just the common culture of the city, and also for people who are of multicultural backgrounds. The third thing that was identified in the community needs assessment has to do with disparities related to race and ethnicity, sex, and income. So these are, disparities are essentially where people have inequitable outcomes, and it's attributable to a factor that they typically don't have a lot of control of, such as race or sex. So, so this information was gathered mostly from looking at Census Bureau records, State Office of Superintendent of Public Instruction, and a citizen survey of Issaquah. And what they found is that depending on your race and ethnicity, you may be more likely to have a lower median income, a higher poverty and status and unemployment rate, lower high school graduation rates, lower educational attainment, and a less perception that you live in a safe and welcoming neighborhood. Women were likely to have a lower median household income, higher poverty, and higher unemployment. And low-income households in the community are more likely to have lower high school graduation rates, lower enrollments in post-secondary education, and have a lower perception of the availability of affordable housing. And then the fourth thing that came out of the community needs assessment work from 2016 was an understanding that that barriers themselves were one of the main areas that prevented the community from being its healthiest self. We know that those barriers can often be related and go hand in hand with some of the disparities that we just talked about. But if you think about it, if you're trying to access services and resources in the community and you don't speak English, or you have a hard time getting around on the transportation system, or you don't have a car, those are the types of things that will prevent you from getting services that you need. We also found that it's the availability and location of providers. Some services just are not offered in Issaquah, or if they are, the available appointment slots are so few that people have to go outside the community for help. There's also a number of insurance limitations, particularly for people who have public insurance. And there are a number of resources that people just aren't aware of or don't know how to access them, and there can also be some legal barriers. So these 4 things, the barriers, the disparities, affordable housing, and behavioral health, in 2016, those were the top 4 items that were preventing Issaquah from being its healthiest community. But what we found when we went out to the community to verify these needs is that there were additional community needs that were that we thought would merit inclusion in the healthy community strategy. One are the needs of older adults. So older adults have particular needs for socialization, for mental and physical health care, and for a number of other supports. We heard over and over again, talking to people, that a big gap in the community needs assessment is that it didn't address the needs of older adults to age in place in the community. So we went back and adjusted our scope of work to include that. The Senior Center also had some money to do a needs assessment for older adults, and so we're working in conjunction with the Senior Center on that piece of the work as well. The other thing is that came up over and over and over again was that people experiencing homelessness in Issaquah are a very, very high community need. In our discussions, we found that oftentimes various aspects of homelessness are quite invisible in the community, and also that while there's some needs for immediate and urgent assistance, there's not as many supports for helping people to transition into permanent housing or to provide some more long-term supports for people experiencing homelessness. So that's basically, in a nutshell. I just went over very quickly where we are in terms of community needs. In the memo that we sent to the Joint Commissions, I went through and detailed all the different parts of our scope of work. And we're getting to the end of that first part of the scope of work where we are identifying needs, and we're transitioning into the part where we're trying to define what is Issaquah's role in looking at those needs. So in terms of looking at those needs, we thought it would be useful to dive just a little bit deeper into the information that we've collected so far. And one of the things that's really clear to us as we started working on these needs and talking to the community is that all of the needs, all of those 6 needs are very interconnected. So, for example, housing affordability is very stressful to many people in the community, but that affordability can be amplified by various disparities. So we know that from the disparities information, there are some people who have a harder time finding affordable housing based on, who have a harder time finding housing that they can afford based on their sex or their race, for example. But not being able to find housing that you can afford can really increase stress, which feeds into issues related to behavioral health, such as anxiety, depression, and substance abuse. And when people are burdened with the cost of housing, they have fewer resources. They make those types of trade-offs that I mentioned before. And once they start to make trade-offs, so you're living in a house but you can't quite afford childcare, you don't have quite as much money for healthcare, then some of those barriers about being able to find quality after-school care or being able to connect to a doctor that's right in the community become much bigger issues. And so instead of trying to tackle these issues one by one by one, because they're all interrelated, we thought that we would look at some of these issues by using the human life cycle. So one disclaimer here is that a lot of the underlying issues that we are talking about here are major societal issues. So things like gender or racial discrimination, those are things that are beyond the reach of a single jurisdiction, right? And a single community strategy. There's also regional issues that have to do with housing affordability and transportation. These are things where the city is already working, and I'm sure the Planning Policy Commission knows a lot about some of these things, but the city is already working a lot with housing strategies and all kinds of things to coordinate with the region in order to try and make a difference in affordability. So the goal of the Healthy Community Strategy is not to repeat this work that's being done regionally, or to tackle some of this work that is just not possible for one community to tackle. But what we think is that what we can do is look at ways that Issaquah can specifically address some issues in the community over the next 3 to 5 year period. And so we also think that using the life cycle will help us to target those things where we can move the needle in the next 3 to 5 years. The other thing is that one way of thinking about needs is that all people have needs for the aspects of a healthy community throughout their entire lifetime. Children need a secure home and access to quality education so they can build their foundation for future success. Youth need support for healthy physical, social, and emotional development as they start to transition into adulthood. Adults need supports like housing, transportation, and social support systems to help them remain resilient as all those life issues come up. And then older adults need all of these things plus inclusion and engagement to maintain connections and well-being. So people rely on their community throughout their lifetime. And it's inherent in a lot of what we take for granted, usually unless something isn't working, right? So when the transportation system breaks down, then we really realize, like, oh, it's not working here. And there's some people in the community who have access to more resources, and they may have more access to those resources because of wealth or social networks, or what kind of insurance they have, or things like that. But a healthy community is one that's going to support and build safety nets for all people so that at every stage of life there's a safety net for people who don't have quite as strong of a network in those things. So let's talk about a profile of, we're going to talk about 4 areas, life cycle stages, and the first one is children and youth. So the information that I have here is not all of the information that we have. We have lots and lots of information. If you took a look at the Healthy Community Strategy, there's lots of statistical and demographic information in there on all types of things. I specifically went through and chose what I thought was the key information for us to think about tonight. So we'll start with children and youth. So about a quarter of Issaquah's population is under 18. And we know from research that children who are living in areas with higher rates of unaffordable housing are much more likely to suffer from poor health increased behavioral problems, and lower school performance. Some of those things come as a result of some of those trade-offs that parents are making to be able to afford the housing. We know that a little less than a third of the families in Issaquah school district speak a language other than English at home. And we also know that graduation rates for African American and Latinx students are about 10 to 15% lower than for students overall. When it comes to some behavioral health concerns, we heard very clearly from youth that they feel a lot of stress in their day-to-day lives. It comes from pressure from achievement, bullying, racial discrimination, and homophobia were things that youth reported to us. We know from the Healthy Youth Survey that about 40% of Issaquah seniors, I put high school seniors, that doesn't necessarily mean they all go to Issaquah High School, but just because we'll talk about older adults later, and I didn't want to confuse high school seniors from older adult seniors. But nearly 40% of 12th graders in Issaquah engage in current alcohol use. So the question, I believe, is have you used alcohol within the last 30 days of when the survey's taken? The survey's done every 2 years by the state in all the high schools of the state. So also on this survey, more than 25% of Issaquah 12th graders have seriously considered suicide at some time in their young life. We also know that there's very few mental health services available to youth in the community, and that youth felt that there was some stigma related to accessing services in the school, because not only do they have a pressure that they may feel comes from their families, but they also have a peer pressure to maintain this idea that everything's going along fine and I don't have any problems, right? So to show up at the counselor's office or to be seen going in and out can sometimes have a stigma for youth. So a few things that we know about people in adulthood. So in general, when we look at Issaquah compared with rates of disease for preventable disease in King County, health indicators show that Issaquah's about average or maybe a little healthier than average in every measure except for heart disease. And the heart disease is actually double the King County rate, which I thought was interesting. Cancer and stroke and other things were just about average, but heart disease is about double. About 6% of residents have no health insurance at all. And about 5% report that they have unmet health needs that they can't afford to get treatment or care for. We know that behavioral health care, again, is particularly difficult to find in the community and almost impossible if you have public insurance. Also, there's no treatment resources for substance abuse in the community. So we had lots and lots of instances where people reported that they needed to leave the community to find providers that either accepted their insurance or were affordable. And then I'm going to jump down to the bottom one, decentralized services, where people have to leave the community and maybe go to Bellevue or Seattle or other places, are very difficult to access, especially if you're taking public transportation. We also know that for parents, there are very few childcare or before or after school programs available. And more than that, if you are a family that can get some assistance with childcare, there are no programs that take there's no programs that take a state assistance coupon to help pay for childcare in Issaquah. There's one exception. There are a few spots available in the Bright Horizons at the YWCA Family Village. But they're only available to families that are in the family village if they have a childcare subsidy. The other thing that we heard from a couple of sources is that where there are before and after school programs, it's a first come first serve program, and so those are very difficult for people who you have to get on a waiting list if you're not first in line. And first come, first serve programs actually tend to benefit people who understand how to use bureaucracy and apply for resources and get in line for things. And also, if you have an urgent situation where you need childcare, you can't find it in the community because those have long waiting lists. So, culturally, 20% of the households speak a language other than English at home. This is a little bit of a different statistic than the 30% of people, of families in the school district. And that's because not all of the households in Issaquah have somebody in the school district, right? But on a whole, 1 in 5 of the homes in your community is not speaking English inside of there. We already saw that people of color tend to feel that their neighborhoods are less safe. And we heard in many ways that it's very difficult to find health and service providers that are culturally appropriate and speak different languages and meet the community's cultural needs. But it's not just for people who come from cultures that are far away. We also heard that, for example, African Americans, particularly African American women, had a hard time finding providers in the community that they could identify with in terms of meeting their cultural needs. So we also heard loud and clear that immigrants tend to be experiencing higher levels of stress and some behavioral health issues that they attribute to some of the unknown implications of the national political climate. Now that comes from the original community needs assessment, which was in 2016. And so that was after a big election. So we did hear some more about that, but that particularly came through during that year. And also there's very few opportunities for learning English in the community. So the opportunities that exist don't always have the supports that someone who's learning English needs, which may be some childcare support or the ability to get there without transportation. If you don't speak English, you can't get a driver's license, so you're reliant on public transportation. We also heard from some women who live in the community that if their husband speaks some English or speaks English and they do not, it's extremely isolating for them to not be able to get out and move through the community. They would love to learn English, but it's very difficult for them to find classes that meet their need. So in terms of households, the median household income is over $100,000, but the income needed to afford the median home in Issaquah is $196,000. So this helps to underline the need that there's a lot of cost burden households in Issaquah, and it isn't necessarily people who are below the median income who are having issues with housing affordability. So about a third 32% of all households are spending 30% or more of their income, which is the test for being cost burdened in the community, and 14% are spending more than 50% of their income on their mortgage or rent. The other thing is that from a housing perspective, 30% of the households in your community are just one-person households. But there's only 13% of the housing stock that is studio or one-bedroom apartments. Now, not every person who's a one-person household wants to live in a one-bedroom apartment, but many people who are a one-person household, especially if they are facing some issues with housing affordability, would love to live in a unit that was smaller and more affordable for them. And so there's a big mismatch between the demand and the supply of those smaller units in the community. The cost of living is a significant stress for almost all adults, and lower income households feel stigmatized. We heard in some of our engagement with lower income folks that they were particularly worried for their children because when something goes wrong in the community, they feel like they're targeted or they're blamed for small crimes or things that go wrong, and they feel that their children don't get as many opportunities because they're tagged as being from a lower income household. So a lot to think about, a lot that adults are dealing with. When we're talking about people with disabilities, and that there's a wide range of different abilities in the community. They can be physical abilities, which can include use of a wheelchair or other physical impairments. They can also be developmental disabilities or mental health disabilities. And so there's very few apartments in the community that are accessible for wheelchairs or people who need help with mobility. And for people who have mental, developmental, or cognitive differences, what we found is that mostly those adults live with parents or family members for as long as they can, but when they must transition out of family care, there's almost no place in the community for them to go. There's very, very few places for them to go where it's both affordable and well-staffed. I actually talked to a woman at the health fair where we were doing a pop-up who had a really heart-wrenching story about her friend trying to find care for her son who had mental illness. So the other thing we find from the census is that if you're a household and that has a person with a cognitive impairment, you're much likely to have one of several housing issues. And these would be cost burden housing or houses that don't have full facilities like plumbing or, plumbing or kitchen facilities, things like that. And so for the majority of those households these are the number of households that have a person with a cognitive impairment and one of those housing issues. And these numbers are just for Issaquah. So households with someone with a cognitive impairment who are extremely low income are very likely to have significant issues with their housing, including cost burden. But you can see that some of those issues range across the income scale. So, aging adults. For aging adults, all of the issues that we just talked about for facing adulthood, those are all things that are faced by aging adults. But just to keep in mind that there is a little bit of a different emphasis and there is a bit of a nuance when it comes to how these things affect aging adults. First of all, older adults are much more likely to have either low or fixed incomes, so they cannot keep up with the cost of living. So even if they had a fairly prosperous and well-to-do life until they became older or retired, they still may not be keeping up with the cost of living. And so there may be many seniors who for the first time are facing some of the barriers and burdens that low-income people in the community have felt for a long time. Older adults can have less ability to drive, and so they're more reliant on a strong alternate transportation network. They also are more likely to have any of those types of physical disabilities. They also could have sensory impairments like hearing or vision loss that require some specialized assistance, transportation, housing, or other services. And for older adults from other cultures, we talked a little bit about how some people from other cultures, the language barrier prevents them from feeling connected with the community. It can be particularly difficult for older adults who are not proficient in English. Health-wise, older adults have about the same level of health as other older adults in King County, but that isn't that great. So there's for all of King County, but Issaquah included, there are some large gaps in preventative care. For example, about a third of older adults have not received a pneumonia or a flu vaccine. And we heard from services serving older adults and aging adults themselves that sometimes they need some assistance in managing the continuity of their care. There's a lot of things that are changing, and having someone who could help them navigate that would be very useful. Also, for older adults in particular, for everyone, social connections are very important to health and well-being. And it's one of the most important things that community offers us as human beings. But for older adults, social connection is absolutely essential for health and longevity. So where there are language, transportation, financial, disability, or impairment barriers, those can sometimes be life or death situations for older adults. We also know that the number of older adults is increasing. It increased from 2010 to 2017 by about 27%. It's expected to grow, the population is expected to grow through 2040. About half of the older adults in this community are living alone. 5% of them are veterans. And we know that they're experiencing cost burdens, if you look at this chart here, at all levels, but particularly those who are living on those low or fixed low incomes, and also those who are living alone. So the living alone is the lighter color on the bar chart, and they're much more likely to be cost burdened, as you can see. And then our last life cycle section has to do with homelessness and housing insecurity. And you may ask yourself, or you may say to me, Erica, homelessness is not a separate part of the life cycle, which is true. However, the issues related to homelessness are so specific that we didn't think that they could easily be addressed by looking at them throughout the life cycle, and so we pulled them out to address them on their own. When we talk about people experiencing homelessness, we're also talking about people who are housing insecure, those who are living right on the bubble and may go in and out of homelessness or may be very close to homelessness. Some of the contributing factors in this community related to homelessness have to do with mental health, drug dependency, gender identity, domestic violence, and housing affordability. And in talking with people who are experiencing homelessness and in talking with people who are dealing with people experiencing homelessness, a lot of the issues are very invisible to the broader community. So you may see people who are experiencing homelessness throughout the community, but the full extent is often hidden in places that you don't see. We know there's over 100 students in the school district that are experiencing homelessness. That number goes up and down a little bit, but it's been over 100 for a while. One of the interesting things about homelessness is that outreach to homeless people is staffed regionally. What that means is that the person who comes to do outreach only comes through the community on a rotating basis. If the police or someone else in the city has someone who comes across a person experiencing homelessness who wants some services, they have to call them on the phone. Hopefully that person is available and get somebody out. They're as responsive as they can be, but they serve a wide area. One of the things that we learned about outreach to people experiencing homelessness is that it takes lots of contacts to build up trust for a variety of reasons. And so infrequent contact makes it really hard to build up the trust that's needed to help people get into some programs for help. Also, some of the service that is available in the community, such as the food bank, those are really good services for urgent needs, for either homeless people or people with housing insecurity. But to try and transition into more stability where you don't have to rely on urgent services, those paths to self-sufficiency are not available in the community. You have to go elsewhere to seek those. Okay, so that's a quick introduction to what we have learned about the needs in the community. What we're going to do now is have a bit of a discussion, and we're going to break up into 4 groups, which someone set up the tables. Yes, Monica?
I was going to suggest, since we don't have as many commissioners present today, that we may be able to just have 3 groups to also allow for representatives from both commissions to be at the same table, because we do have some tables that have just one type of commissioners, but open to it.
Here, I have 2 questions before we start the discussion.
Please.
You said that 40% of high school seniors had reported they used alcohol in the last, I believe it was month. Drugs?
So there are some statistics for drugs. I didn't have those at hand, but I can pull them. My guess is that in the healthy, so those come from the needs assessment. Those are 2016 numbers. We should be able to see the 2018 numbers now. And my guess is that whatever the rate was in 2016, it didn't stand out from the rest of the communities around it, so it didn't make it into the needs assessment. But it does measure drug use and also trying drugs.
And the second question is that when it comes to adults, seniors feeling stressed about the ability to maintain, to age in place, inflation has been at historic lows since 2008. So would it be correct to assume that in King County in general, it's real estate taxes that are the leading cause of this in terms of rents going up because the owners have to pay the taxes? Or if you own a home and have been in it for a long time, one of the city councilmen, I believe last week, noted in his comments when it was the budget discussion that taxes on his home have gone up 28% in, I think he said, the last 3 or 4 years. So Do we know what the primary cause for aging in place, what the primary cause of angst is if it's not inflation in general?
Well, so we didn't ask people to comment on the source of the anxiety about it and the stress. We just know that the housing and the income is not a match, and that makes people stressed. There would need to be an analysis to see, like, of the increase in the cost of housing, what percentage of it is taxes or attributable to other things. But even though inflation affects the cost of living for other things, the price of housing has increased much higher than the cost of living in general. Yes.
You mentioned your homelessness and your housing security. They're one target. Do you have the breakdown on the homeless in terms of percentage versus housing insecurity? Because housing insecurity, people that are insecure of losing their housing, the drivers of that and depression and anxiety, I would have to imagine are a lot different than what's driving homelessness itself.
So, yes, to some extent. So, and those things are also considered in that section that has to do with adulthood. But we include people with the housing insecure in that section with homelessness, because what we find is that prevention strategies are often very helpful in preventing homelessness from occurring in the first place, and that's targeted toward that housing insecure population as well. But a lot of the resources that go into prevention strategies can also be used for people who are already experiencing homelessness. So it's a little bit of a double coverage in our breakdown of things here. But if we're looking at the percentage of people who are housing insecure, definitely the 14% of people who have a 50% cost burden or higher would be considered housing insecure.
Erica, if I can add to that, and I think maybe Monica has the details on it, but there have been some studies that have looked at correlations between rising rents and homelessness, and there is a direct correlation between those two pieces.
Yes, the Department of Commerce has good data on it. And I also found the information on drug use, just as a summary. And I'm just going to focus on 12th grade because the Healthy Youth Survey has it broken down into a lot of details. And so for substance use, for example, marijuana use is one of them. However, that was actually the positive information, because for 12th graders, the use of marijuana went down from about 27% to about 16% of youth. However, everything else looks unfortunately worse. Vaping seemed to be in 2018 the worst problem, with 62% of high school students reporting use of vaping. So kind of like as a quick summary, those are in the Issaquah School District.
Okay, so I have some instructions here, but we'll modify them a bit. So we're going to have a small group discussion to talk about these two questions. Each group will be assigned one of the Lifecycle groups, and we'll split into 3 groups here. Each group should have representatives from both commissions. And we want you to we'll probably spend around 10 minutes talking about these questions. Somebody, Monica or David or Trish or I, will be around to help take notes on some of these big boards here. And then what we'd like you to do is pick a person who will report back to the larger group some of your top answers to these questions in just like a 1 or 2 minute summary, and then we'll discuss them as a whole. So the first question is, given the information that we just discussed, And you all have in your packet, you can refer to the slides if you want to look back at the slides for the Lifecycle Group that you will be working on. So what do you think are the gaps in health and services so for your Lifecycle Group? So what are the things that are preventing them from living their healthiest lives, and where do you see those gaps? And then of the things that you identify as gaps, what do you think are the 3 most important issues and topics to address? So how would you like to do it, Monica?
I just realized that we have 4 life cycles, and that's where we are going to do 4 tables.
Exactly. Do you want to still do 4?
Yes.
Okay, let's do 4. We have 5 at this table. Could we have maybe somebody from the Planning Policy Commission join our commissioners there?
And then do we have a preference on how we assign life cycles?
Should we do homelessness back there? Children and youth? That sounds fine. Adulthood and older adults? Is everybody okay with that?
What do we get?
Children and youth. Yep.
For adults.
But if somebody else would like to be the person to report out.
Nice to see you again.
Loretta.
So we're going to go.
Yeah.
We only have one
Yeah. There is, however, I can.
Okay. So when we're talking about adulthood,
my information, and I was the one actually to outreach directly to homeless
what do you
individuals.
think
I feel like
are
I
the gaps, the biggest gaps within that life cycle?
So,
Well, I mean, I'm forever talking about that part.
This is on the second.
Yeah, or, I mean, I guess first part's kind of
and
like
so
thinking
for
about
them,
what
maybe
they
we
do.
can start a few things that just came out for
All this information that we read prior to
what we
today.
try to do
Outreach
to homeless
Each time it's
individuals.
mentioned, it's a
What is the
different
difference in Issaquah compared to the East
or
King
it's the
County
first
or
thing
the
it's
right?
even a topic.
And one of the
In one
major
sentence
things
is
if
all
you go
that's
to
said in
Seattle,
the
you'll see
whole
homeless
title.
individuals everywhere. However, in
I just think it
Issaquah,
doesn't
you don't
begin.
always see them as, and they're not as obvious as in Seattle, right? However, that is misleading because it doesn't mean that we don't have a population of homeless individuals. And one thing we have that's different in Seattle is a lot of
Do you guys want to talk a little bit about kind of
more and more
gaps or
homeless individuals.
One thing that struck me is
Right.
When
So that's one
where
The second
services
one
are provided. So we all know sort of what some of the key pressures are, but then there's also the dual problem, right? The stigma associated with getting help in school. So what does that mean for alternative locations and
600 miles
communities? So
So it's kind of a stigma and location,
yeah,
kind
it's
of
sort of
visibility.
matching the resource
They make it to Seattle, to
and
Issaquah,
location to where the
every
need
6
is.
weeks or
Yeah.
so.
So
If
it's
that's
sort of-
lucky. And
I think so.
It's important to build a relationship and for the homeless individual to trust someone when they accept services. It's really finding that service, but it's really not effective for Issaquah. So that's also another expectation. Then when we outreach to homeless folks, for example, we have an organization
So it's like a supply demand mismatch.
dinners at the
And so you're seeing that people are using them, but it's okay.
and they provide dinner every evening. So I went there and then engaged with homeless individuals and asked them for what they thought that the gaps were. The 2 things that they mentioned were it's great that there's a shelter that is living and kids for many, many years. Many of them grew up in Issaquah.
So they're kind of overwhelmed, so there's that little, the impact is
And they realize that means that they might be on the streets, but this is home for them. So definitely, not that they're on the streets. Yeah, exactly, right. So one of the main things they were very the second thing that came up
This is how we have
like the United States that space or another space to be available
so again, rather
as a
than
day
having
center, like just a place for them to be out again, but not just for a place to hang. Like what they were seeking was, can they have
So do you think that there could be an issue where few resources are
Sorry to interrupt.
so the highest bid, and then that leaves this big gap
Yeah,
of
and it's
people
basically, it would be nice to have like
something
a
that rises to the level of acute, but is, and the other thing I'm thinking is, there are certain students who need help with mental health issues, but then there's others who might just need counseling, direction and focus,
and I understand.
guidance about what to do,
Yes and no. I
and
think
social
definitely in the
support,
winter,
things like that.
My mom is Spanish native.
they're more focused on
I get it. It's important to have some of the bigger languages.
however, the Issaquah library is also highly utilized by families with small children, and I don't think that not comfortable yet, so you don't see groups often, and it's also not a large setting. So I think if you go to a larger library in Bellevue or downtown Seattle, there are places where they can find a corner that can be all of the elements. However, not so much in the
What I was thinking
And so
also.
it's also a
so
mismatch,
what
sorry,
we
it's
think
a
is that
mismatch of
goes
kind of
with
the response to
other
the,
things that we saw like our Parks and Rec
need, I guess, is
department and the
That's what I was trying to say.
Acuity and the need.
try to find shelters there. And so again, I think
And obviously,
when that impacts other residents,
Like a triage of the
access
acute
services, so it's
there's also extensive
chronic issues.
second language
Well,
programs.
because the other thing I was thinking is, if you start to maybe categorize the two, it could open up additional resources for that acute, kind of more counseling and social support. So like a certain set of professional counselors might be focused on like,
Question for me is how,
really
where,
I think of harming myself issue, but then another set of volunteers
how
might be
aware people are, and then
should I
once
go
they're
to
aware
college
of
or
it,
not? Or,
then
you know,
we get into the access that the classes are after hours.
I'm not getting along with my friends anymore. You know, are there sort of like different types of professionals for different types of?
I'm sorry, I missed that, but that's, I think classes focuses to
Or does
the entire school. So there are volunteers.
So there was people they already had.
And when you go on vacation, somebody comes in. So it seems to me there's
And just like all of us, since we've been
so I don't have a fire to learn it. So I would suggest
that's why
teachers keep
bringing it up. And
and then then we can
it's great to spread awareness. Whatever circumstances I need on and rely on.
These things when
We have like an idea.
really want to.
Are there any peer counseling for other reasons? And why do you think that's true? Is it not effective, or is it just not?
I have some data. I just came back last week from a training with Commerce, and there is data at the state level that shows that actually there's a misconception in the youth saying that most of the people who are homeless are drug addicts. Drug addiction is only 10% to the homelessness. Most of the time it is something that, yes, people live paycheck to paycheck, and something happens. They're one, exactly, they're one paycheck away from, yes, halfway from layoff. And so the interesting factor is that they were sharing with the department is that actually what causes homelessness is the high salary. So they made these correlations with high salaries to trigger high rent, which then triggers some engage those who don't through so yes, and then for Issaquah, languages of India, and also for the young Spanish, actually one of the
So
it wasn't ignored.
But it also
mental health or
yeah, let's
however, many we
Miami, right? Get a drink of water here. We're adulthood.
It's not enough, but also put
Yeah, we're kind of looking at the language. I think one of them was.
No, the other thing that are, so we did a site visit to Miami and the schools, as part of our commission duties, and what we found is that there are excellent programming and volunteer
think
resources.
part of the issue for safety has to
coming into
schools
because of gatekeeping.
is also
So whether that is, time, whether it's attention, whether it's, I don't know what it is, but it's like you've got people knocking on the door saying, medicine, and they can't even get it. So why is that?
They feel like strangers, not neighbors,
open it up
right?
to organizations
So I
like
think
that.
that's the issue.
Can I, because I'd like to make an observation on that I think is relevant.
Spin on that one too.
One is that it seems to me that it seems to less supporting line
The city took over this scene?
there's social time looking at the screen.
I think what you miss is that part of the equation is not the support of parents.
There is
A mother's
a better thing called
the data bears this out. A mother's
about where people are usually. Yeah, nice to know you, but
some of these are solutions.
Right,
And-
because we're
and
such
so
a
that's
housing that is moderately affordable.
Kids are one of the
Housing rentals, and
But there
also.
are
unless there's resources.
that don't know their next door.
I like the idea behind best starts with kids, right?
Housing communities.
So many United Nations.
And that's support.
The only reason
And also that starts at 0 to 5.
Yes, it is.
It's doing middle schools.
I see them coming out.
One of the other strategies that maybe the schools tried or is getting back to the TSA. Does anybody know if TSA is effective, or is it a body that can make a difference in the schools, or is it more of a social thing?
Or to your point, in a way.
Policy.
So right. I don't know someone like this problem.
But could they be advocates for families who might be dealing with like almost not an official way into the schools, but an alternate way to support the family?
Here's what happens when she leaves school. When she leaves school, so there is that, I think. Sort of
PTA is also.
and that kind of I'm wondering.
We can write down the names we want. It's the top
Tactics like this, right?
Yeah, the circle.
Yeah, because I,
So I have to go back to anything else.
that's
If I just look at the presentation services to me, like whatever people got,
it's
not enough affordable seniors or health resources.
it's only about 3 times 3% a year. It's not
Well, there's state somewhere else.
yeah.
Okay, everybody, if you haven't already, try and come up with your 3 most important issues to address to report back to the group in just a few minutes.
I love the idea of doing something tangible, even if it's smaller, because yes, like we know the big issues, like okay, we need more tools.
Sorry, we took you off track.
Volunteers, you're talking about volunteers.
Yeah.
Yeah, you're right. PTSA doesn't have a lot of say on there.
Accessibility, I think, is transportation and resources. And kind of a,
like having something like definitive that I think the thing I struggle with the report thing is like I think it does create awareness, but what are we looking to get out of it?
Yeah, sometimes one of the things that I said last time there was another work that I attended.
One other question, and so of this, but I asked this, but I saw a presentation by a nonprofit organization that was focusing on educating people
and interact and just want to sit down. Like for me,
and
it's so
that had
valuable
to
to
do
sit down
with
and have
making
dinner.
sure that kids were aware when they were putting themselves in their situations. And they said that's a big problem in Bellevue, and they're also targeting Issaquah as well. Has that the same as awareness of any advisory boards in your school? Is that so that is not something that's front and center, and that's not something that works?
Right, you don't have
Okay. Well, I don't want to introduce it. I just wanted to ask if it's.
Yeah, and I didn't take your billboard, literally billboard, but what you were trying to say was changing the language, change the language, use a picture, tell a story, right? Yeah, that, because it's
So,
there, but for the grace of
we've
God.
talked about 3 things in this group.
We talked about the importance of
Okay, so
child
changing
care.
the-
We talked about the importance of being able to communicate in English language.
And this was more about
And we
the
also
vulnerable
talked
people
about
who take advantage of you, not
of getting to know
more
one
than
another and connecting as neighbors. Are those the three gaps that you think
Should this shut down? What's the effect of this? I mean, isn't it shuts down the conversation?
That could be
And I think that's part of the what do we do?
Exactly. Right.
I know when I was like, policy and
Well, I love it when they say it's the, you know, the greatest city to live in. That's why it's like, what's the criteria? You know, because right, they have to redefine principal criteria. Or sometimes it's someplace like in Illinois wins the.
It's on several, lots of issues.
Basically, Fred Myers, all the way up to physical, that's not a realistic.
I don't know.
That's exactly what I'm basically. I'll get you the name of the place.
I saw it, I assume everybody here saw it in the Seattle Times report 2 weeks ago.
What'd you say, Derek? Use voice?
Income city with a population over 60,000 around the room doesn't matter. Highest income
I'll send you that.
Yeah, why shouldn't the youth voice find priority?
We have no
But the telling the story in an authentic way.
Here for 120 years, it was the year where most people found out what was
Small
going
things
on.
sustainably. Guaranteed way. Small things is sustainable. Much better than a big
It was.
one-off.
And we don't have that.
We don't have Christmas once a year, right? You need
And that's
a shower 4 days a week.
subscribed to it. And the reason it went away is because people were using
No, you should. No.
Julie, yours.
I feel like you guys have the good idea. We can do it together. Let's see if you can synchronize talking.
You know what, you start, and if I feel like I need to add anything, I will. Like that, no, like that.
We want this community to subscribe to you.
That's so big, right? That's so many.
My pension thanks you. I was a reporter.
What do you guys think? So what daily newspaper? What are the minutes for this?
I never read the Issaquah reporter, but I always remember.
Oh, shoot, we didn't do the whiteboard.
So I don't remember the dates of the Issaquah reporter.
That was my problem.
All right. Now people are going to listen to you. Willing to present back to the group?
Something about the
Half of what
mismatch
we
as
talked
well.
about? Yes, for sure. Okay. Please.
Big grand the mismatch. as well.
If you can read my handwriting.
She can't get up.
Are you
I'll
okay?
hold it for you.
Would we also?
Loretta, I'm not with it or something.
You want me to hold it for you?
Yeah, please. Oh, don't worry. And I'm sorry I had
About what you're thinking about.
Okay.
Like a day shower center.
What?
Stopping kids from falling in the rubber instead of pulling them out.
Thank you so much. And I'm sorry.
It's just not done.
I took notes.
You're second.
I think we're good. We're good, guys. We're more than good.
We can't eat.
Okay.
Is that clear enough?
Why don't we take,
So prevention,
Why don't we take a second, even if you didn't get to your 3, our group didn't get to our 3, it's okay. Why don't we go through and we'll go through in order of the life cycle and people give just a real brief 1 or 2 minute recap of what you talked about, and then we'll spend a couple of minutes after each briefing and other people can add some comments as well. So let's start with children and youth. I can't remember who had that group. Oh, wonderful.
David, that's us.
Oh, great. All right, so who's talking? All right.
Who's standing, David?
You're standing up and have the whiteboard.
Sticky notes.
So youth and young adults, we talked about a variety of things. We talked a little bit about the stigma and the resource, the match of the resources, and whether kind of the location or visibility might be an issue. But then we quickly kind of went into a discussion about the demand for the resources that are available for youth, far exceeding the available supply. And so what that causes is an intervention response, a kind of crisis, if you will, response where there's maybe like a big population of need, but only a small resource available, and so that becomes more of a triage kind of a function, and because of that, it may not actually match what the actual needs are, so you might have kind of lighter, for lack of a better word, needs that might not be that might be addressed, but the more serious issues might be met with a lighter response, if you will, so there's causing a disparity there. That goes along with, because there's so much of a focus on intervention, that there's a lack of a focus on prevention. We're really trying to get at the move upstream and address the core issues. The group also talked about, similarly, there's lots of talk about awareness building and education, but it's not always backed up with the resources to be able to take actions. And then with the limited resources that are available, they don't kind of go through this review of what are the best practices and whether or not they're evidence-based and whether or not they are able to deliver on what the objectives are, being a little bit more strategic about that. We talked about some ideas about having volunteer resources in the schools or potentially doing some work with the PTSA, but really backing those up, that kind of awareness side, backing it up with resources. A need for more support for parents and families. And then one of the other priorities was having more of a youth voice in the picture, and those could help drive school policies, drive city policies, asking students rather than kind of telling them, here's your information, go take care of it on your own. So anything else wants to add?
How about the larger group? Are any thoughts to add to that list? Yeah, that's all of us.
Larger group.
Well, it's okay. I mean, we can move on to the next
I think your point about triage is interesting because, again, if the resources aren't there and you have a higher need, you're right, you're absolutely right. You're going to try and work with what you have and try to take which one's in a worse state first, and that leaves a lot of people that you might be able to prevent, unfortunately, coming to the fore. So, point well made.
Yeah, I like the idea of like the prevention, and I know that like, you know, that it's very, there's a lot more like diversity inclusion like in the workplace and stuff. I don't know like what kind of training we do or programs we do for like diversity and inclusion type of, you know, awareness for kids and youth. I don't know if we do that. I mean, it's a big thing in the workplace, so it should be a big thing starting when you're young, right? So
It's a good part of the anti-bullying conversation, and that's a big conversation in the schools. So I think there is a dimension of that.
Okay, adulthood.
We're up to adults already. We started out with the first thought was that one of the big stress points for adults, especially those who are parents, is the inability to have affordable child care. It makes them miss work, it increases their stress, it puts a lot of stress on the children, and we're one of the few societies in the world that doesn't provide child care for young parents, so we have a long way to go there. Our second point had to do with language. All the things that we're talking about, from the moment that we start talking about them, have to be in languages that people understand, or we have to be getting information from those communities that are not speaking English. So the whole language question is an extremely important one. And basically what we moved into actually talking about strategies, and it was interesting that Jason brought up what they do in Israel, Upan, where is when you come into the country, everybody is immediately put into an immersion group. And for 3 months, they're immersed in Hebrew language. So that there's a common language that even though they may get brochures in their own language and things like that, there's a common language that is shared, and it's much easier to convey your values and your principles and to make people aware of the resources that are available to them. All of those things can happen when there's a way to communicate that everybody understands. Randy brought up that one of the big things here is we have a lot of resources for language. We have free ESL classes. We have all kinds of things that people can do to learn English so that we would all share a common language, but so many people are not aware. They don't know where those languages are being taught. They haven't been convinced that they ought to try to make use of them. So there's a whole lot of work that still needs to be done to get people to use the resources that we have. And then thirdly, we had quite a nice discussion about the Seattle freeze. That one of our big stresses for adults here are that we don't know our neighbors. We can't rely on our neighbors because we don't know them. We don't spend time with them. We don't get to know them. And therefore, we're not in support of one another. So we have all these people feeling isolated and feeling as if they're strangers in their own community. They really don't know what's going on. That is also aggravated by the fact that we live in this community that's dispersed everywhere. And I think Jason brought up, we have the Highlands, we have the people in Providence Point, we have downtown Seattle, the old city, Issaquah, the old city. These people are spread out all over with somewhat different languages. We're not the most diverse community in the world, but we're pretty diverse. And so we don't have that concerted effort of people working together to solve our problems and to solve even the little local problems, because we each live in our own little isolated neighborhoods. We also talked about the fact that Issaquah lost its medium for getting people together, for communicating to people by losing the Issaquah Press. And because we don't have a local paper, who knows what's going on? You might find out, but you might not. And the whole notion that a community needs a local paper is getting to be foreign to us. Most of the people that live in my neighborhood do not get the Seattle Times. And my husband and I are out there preaching all the time that if you lose the Seattle Times, you're going to lose the very heart of this community. You've got to have a local newspaper to know what's going on in your community. So anyway, we did some discussion of that. And I don't know, what else? What did I miss, Randy?
Well, we were talking about that she touched on that, excuse me, and the diversity. It's not just the distance from one side of town to the other, it's the fact that it's hilly.
Yes.
And so it prevents people from being able to walk around town unless you're young and active. And most of the young and active people seem to be looking at the screens in their home these days instead of walking around, but that's a different subject. But the physical or the topographical realities of Issaquah are also a factor that keeps us from communicating and building a sense of true community, which is what we're all talking about here. One thing we didn't talk about that I think, I don't know whether we're going to have an opportunity to later on. Jobs are critical to the community. And in the last city council meeting, I think it was brought up that the city has lost more stores in the last year than have opened. And that is a problem. We don't talk about it very much. But if people can't get jobs at all levels, whether it's working at a McDonald's or doing a hedge fund, we're going to be in trouble when it comes to affordable housing and things like that. So I think the city ought to
do more to examine that issue and come up with it, and that's a planning policy thing.
Randy brought up that we have one means of transportation in the city that's free, the little 200 bus that runs around. If you don't have a car, you're isolated. You know, it's just pretty difficult to thrive in this city if you don't have a car.
Anything else for the adulthood section? We traveled a lot of territory. Table. Older adults, is that?
Erica, can I mention, I think we had the commission, or we had scheduled to 8 o'clock originally, and so I wanted to ask the group if it's okay if we could spend another maybe 10 minutes to wrap up the report out and then talk about next steps.
Yeah.
Yes, I'll talk really fast. It's okay. We'll see how this goes. I just quick wrote this down because I wasn't following the direction. Sorry. We had aging adults, and we talked a lot about housing that's not available. We have really expensive housing here for our aging adults, but we don't really have moderate cost housing, or even affordable housing for Timber Ridge and Providence Point, and are sort of super nice and a little expensive, but we don't have any that's just for the regular fixed income. And so we think that's an issue because they don't get to have a community setting, they don't get to have all those services right there. There's just not the opportunity for that. It's just so expensive, the choices that we have here. But also, on the other side of that, there's a gap in services to just age in place, to age in your house that you've had all your life with your community. The Meals on Wheels, the medical services. It leads into access to transportation if you don't have a car and you're trying to age in place, to have things delivered to you, or have a system where your kids or family can deliver things to you. Transportation was another problem that we thought that not only does it isolate a person if they can't get out and get to the senior center, get to the doctor, get to wherever they need to get. Transportation is one of the second issue that we've hit. And the third issue was sort of related to transportation, but it's just access to services. Some of them aren't local, which gets you to transportation again. Some of them, they probably don't even know that there are services available. And so that we started solving that. How do you get the folks at the senior center to be ambassadors to other seniors, to get them to understand that there's all these things out there that they could tap into. But we would have to find the seniors that don't know that and that are isolated to help with that. But so I think access to services was sort of a double prong. The how do we get them to know that the services are available, and then if the services aren't local, how do we find a way to get the folks to those services if they're not easily accessible right here? And did I miss anything? I know we jumped right to solutions as planning policy and human services do. We jumped right in, and then we kind of had to step back and identify them first. But
anybody else to add something for aging adults?
Well, Tricia, it's just the question that I had. I'd really like to know if people getting stressed about aging in place, or what is it that's causing the stress? If you're on a fixed income, if you've done your job and you're on a fixed income, is it the tax on your home that is you can't control, and I just don't know where that is. Well, I don't know how you address that unless we have, not you, but how we address that unless we have data. And that's a survey thing, I guess, more than anything else to talk about.
Yeah, that would, a survey could be done for that, but to have it be a meaningful survey, that's pretty expensive. I mean, it's
you could
difficult
also
and
look
expensive.
at different communities, because I moved from Texas. In Texas, property taxes are capped when you turn 65. Your property taxes do not go up, period. And I just didn't realize that was not a common thing, and there's not that here. You should be able to probably find some sort of comparative study of that policy in where it does exist and where it doesn't exist, and how secure seniors have been in being able to stay in their homes.
That's a good point.
So I'm sure things are different place to place, but I know from my own mother-in-law that her biggest concern is her healthcare costs. It's not her taxes.
Yep.
Right? Those are the things that are breaking, you know,
And that's even if they have
that is hard to
Medicare.
balance a budget, and that's when you can't predict what may happen to you next month. That's her consistent, you know, kind of anxiety.
Yeah, I was just going to add also there's talk about behavioral health and mental health. I think it's important to not forget about the specific needs for aging adults and seniors around mental health, around issues of complicated grief and loss, transitions, end-of-life issues. I think sometimes get or can be overlooked when you talk about broader community needs for mental health services. Just kind of adding that in.
Yep. I would like to just make one comment that kind of underlies all of this. And it was in one of the comments that you made in your first presentation. A healthy community is the responsibility of everybody in the community. It's not the city council's job, and it's not our commission's job, and it's not any one group's job. But I don't see us as a city ever adverting to the fact that most of the people that we have in our communities do not believe that at all. They believe that if they can take care of their own kids and their own family, and they're doing everything that they possibly can, and they're not obliged to do anything more. And I guess I just think the whole education system and everything that we do should have some aspect of helping people become aware of the necessity for this community responsibility that we all have.
That's like is that like a coarsening of the culture? Is that something because of the screens, because of that? Because if you look at like old Amish communities, ultra-Orthodox Jewish communities, again, I mean, it's from cradle to grave. These people take care of one another. In the United States in 2019, not so much.
I think you guys hit it with not knowing your neighborhood. Because there's so many, you know, when you think of
Living in
maybe
community
when you
is the
grew up,
solution.
Right, when you knew everybody. I'm not saying homeland, but you knew everyone on your block. You knew whose house you could go to if your folks weren't home yet. I mean, there was just everybody took care of everybody's kids. It was just you know. Whereas now it's hard to always know, you know, who even lives on the block sometimes.
Trish, can I, to this
Yes.
point, I look at the city website, I get it in with what's happening in Issaquah, and I look at the city website to find things, but I am unaware of there being something on the city website that is an availability folder, if you will, that lists all of the free opportunities for English as a second language, citizenship class, opportunities to volunteer, not just to take the classes, but to volunteer. I think that one of the easiest things to do to address many of the problems that we're discussing here today would be to have a proactive, very easy to access site on the city that lists all the opportunities that are there free.
Communication could take the place of what the Issaquah
Or
reporter did.
or try to take the place, yeah.
Well, our Notify Me mailing lists, when you can go in and you can sign up on the city's website, there could be one for any of these needs. If someone would just once a month put out a newsletter that says, remember, here's this website where we have all of these things going on. It would not take long to do that.
And the new website has a resource page that will provide some of those resources.
But you have to push
it's a
it
very
out
initial
instead
stage,
of,
yeah. But yeah, it's not. Yeah, I don't think that it's live yet.
So Anna, and then let's move on to homelessness after.
An addendum to that comment of resources on the website. There's people that don't have computers, and don't have access, or don't know how to use it. That being putting this idea to different people, maybe somebody will run with it, and hallelujah. We need a spot in the city where information can be posted, and people that can only get to there at midnight or at 3 in the morning or at 2 p.m. Different hours of the day they can have access to that information because the library is not always open. and they can grab, or they have pieces of paper where they can write information they need without being, oh, you're looking at this information, you need help, something that people can have the resources available, whether they don't have a computer, they don't know how to use it, or they have different hours than 50% of the population. We need something, because we lost the Issaquah Press. We need something out there, because we're in limbo land in the city of what's happening.
So, people experiencing homelessness.
Okay, so we didn't write anything down. I'm just going to stand over here so I don't have to look backward. We identified the three biggest concerns for addressing homelessness as we need more affordable housing, and what was the tangent to that? So that's the big thing. There needs to be more affordable housing. And the second is access to services for mental health and just general health care. Two big things. And the third one is it's kind of what has been alluded to already, is just creating more of a culture of awareness and acknowledgement of homelessness as an issue that's real in Issaquah, and changing the vocabulary from a them problem, a sense of otherness, to a sense that the people that are homeless are people like you and me. They're like the girl in your daughter's class at middle school, et cetera, who goes home to a car in the evening instead of to a suburban home. So when we looked at those three things, we can't really change the first one very easily. We can't change the second one very easily, except by maybe encouraging some more of that infrastructure to come to Issaquah. We thought there was probably a good opportunity to make some inroads to changing the vocabulary, and by making it more visible, putting some nominal dollars or community effort into creating some community centers, like at the community center having open showers once a week or twice a week, and coordinating with high school students needing to do volunteer hours, or religious group, faith communities in the area wanting to be able to support this effort. And I'm sure I did not say this very well, so please jump in. But that's kind of where we went with our conversation.
Anything else? Any other comments for the life cycle of homelessness?
One of the great programs that Issaquah has is the Citizens Academy that's done by the Issaquah Police Department, which I highly recommend, along with the CERT class. I mean, those are two amazing classes that Issaquah departments provide for citizens. But in the community academy, the Citizens Academy of the Police Department, one of the things that they noted that is congruent with King County Sheriff's Department and Seattle Police Department is that it is policy when somebody, a homeless person, especially if it's a drug-related interaction between police and the person in question, they are required to offer help on first contact. This is, I'm taking you in, you're going to be arrested for so-and-so, and when they get in there, one of the first things they get is counseling on help that is available with your situation, whatever that may be. And the officers told us, and I have a neighbor who is actually a Seattle officer who is working on the navigation teams in homeless camps, that the overwhelming majority of the people that are taken into custody that are homeless refuse the offers of help. And that's something that I think has to be acknowledged and addressed on this level, because if you have all the programs in the world and you're not communicating the opportunity to the individual in question, there's no possibility of success. So I don't know how we got to do a better job of getting people to use resources that are available.
Well, and one of the things that we learned through that outreach that I spoke to a little bit is that one of the things that helps is having consistent and reliable
Yep.
outreach, because it often takes multiple
Yep.
connections to build the trust
Build
for
the
someone
trust.
to accept the help. So,
Something small that's reliably available is better than a one-time flash, is what we were saying.
and then Rebecca, I didn't mean to cut you off. You had
That's
a
the comment that I was going to make, that the frequency of contact and building trust, and it's hard, even if you have a bad habit and you eat a bag of chips every day or whatever, and like, people are like, well, that's so bad for you, why don't you just, it's, like, it's not that easy, it takes time, and there are reasons people do it, so,
Yep.
yeah, it's just, it's very complicated, I think.
Oh, yeah, it's very complicated.
And the other thing too is identifying the different types of homelessness. There's certain types of homelessness that are brought upon by difficult circumstances. There's also a lot that's done by addiction. I'm sure everyone's probably seen by now that documentary, Seattle is Dying. So again, it also goes to building trust. It also goes to not loosening up the rule of law to the point where people can hold 3 grams of dope and not get in trouble. I mean, that basically cops, 3 grams. I mean, that's enough to kill somebody 3 times over. So there's this interesting program they had in Rhode Island where someone who was busted with illegal drugs, class 1 felony drugs, is not only would they be in custody for a while, but then they're able to do things like take 3 different drugs, but methadone, vitriol. There's a few different type of drugs where if the state were to be willing, it would allow them to slowly get off the drugs, and once they serve, a light sentence, but it takes them off the street, because again, you hear the tiny house thing. They don't want it. They don't want the rules. They don't want any of this, and that's part of it. I mean, I don't think anybody in this room wants Seattle coming to Issaquah. I mean, what's happening in Seattle is just devastating. I mean, I have to drive through that city, and it's not the same city I remember 3 years ago. So, identifying why certain segments and what that percentage is of homelessness, what is drug related, what are people that simply, like you said, the middle schooler who's sleeping with her mom in their car. I mean, that's very different than what's going on downtown.
So next steps. So the information that we collected today and that we talked about, we're preparing a workshop with council, and what we'd like to do is present similar information to council, and we'd like to get some direction from them about some areas of focus within each of these life cycles. So we'll take the conversations that we had today as part of our materials to council, so they have the benefit of your discussion as well. After the council takes a look at it, we're going to do 4 half-day staff and stakeholder workshops. That's where we take this information and the direction from council, and we start working on specific strategies that we think. There we'll have service providers, nonprofits, members of the community. You are all invited to participate in those workshops as well. So I'm sure you'll get additional information from Monica or Trish about that. Once we've done the staff and stakeholder workshops, we're going to come back with some strategies that come out of that, and we're going to have another workshop to help refine those strategies and build the strategy of the little strategies, right? And that's when it will go to the public for review. So a lot's going to happen as we enter this part of really determining what is Issaquah's role, what can we do in the next 3 to 5 years to make a difference in these issues. And so we started with that tonight. So thank you very much for being a part of it and for all your great conversation.
Thank you. Cheers.
So can I just
Well, sure, but I'm not sure if
Yeah,
Derek
so
needs to close the meeting or.
So we're adjourned.